What is the deceased organ donor process for kidney transplants? Imagine a life-changing moment where a person's passing can give someone else a new chance at life. That's the essence of the deceased organ donor process for kidney transplants. It all begins when a patient in a hospital suffers a severe brain injury or is declared brain dead. Medical teams carefully evaluate whether the person meets the criteria for organ donation. If they do, the hospital refers the potential donor to an organ procurement organization, which coordinates the entire process. This referral is usually made quickly, either electronically or by phone, to ensure timely action. Next, a specialized transplant coordinator from the organ procurement organization visits the hospital to review the donor's medical history, current health, and lab results. They check if the kidneys and other organs are healthy enough for transplantation. This step is crucial because it helps determine if the organs can be successfully transplanted into recipients. If the evaluation is positive, the next step involves obtaining consent. If the donor has not previously registered as an organ donor, the family or legal decision-maker is approached with sensitivity to discuss donation and seek permission. Once consent is given, the donor's death is officially declared based on strict medical and legal standards. This can be through neurological criteria, meaning brain death, or cardiac criteria, which involves the irreversible loss of heart function. After death is confirmed, the organ procurement organization works with a national system to match the donor kidneys with suitable recipients on the waiting list. Matching considers factors like blood type, tissue compatibility, how urgently the patient needs a transplant, and how close they are geographically. This process helps ensure the best possible outcome for both the donor and recipient. Following matching, the donor is taken to the operating room where surgeons carefully remove the kidneys and other organs. These organs are preserved in a cold solution to keep them valuable during transport. The kidneys are then transported to the transplant centers where recipients are prepared for surgery. During the transplant operation, surgeons place the donor kidney into the recipient's pelvis, connect blood vessels to restore blood flow, and attach the ureter to the bladder so urine can drain properly. After the transplant, recipients are closely monitored. They receive immunosuppressive medications to prevent their immune system from rejecting the new kidney. The transplant team also provides ongoing follow-up care to ensure the kidney functions well and to address any complications. The donor family and healthcare providers often stay in touch, offering support and updates. It's important to understand that kidneys from deceased donors can come from individuals with varying kidney function, especially if they suffered brain death. Sometimes it takes days or even weeks for the transplanted kidney to start working fully. The evaluation process for recipients is thorough, ensuring they are healthy enough for surgery and can tolerate the medications needed afterward. For those with kidney cancer who develop kidney failure, transplantation might be an option once the cancer is treated and in remission. The waiting time for a deceased donor kidney varies widely, often depending on blood type, immune sensitization, and location. In summary, the deceased donor kidney transplant process is a detailed, carefully coordinated journey. It involves identifying a suitable donor, evaluating their health, obtaining consent, matching organs to recipients, surgically removing and transporting the kidneys, and finally, performing the transplant surgery. This process is designed to maximize success rates and give people living with kidney failure a second chance at health and life. Always remember, if you or a loved one are considering transplantation, consulting healthcare professionals is essential to understand individual circumstances and options.